Parents of preteens and teens have been asking me some pointed questions about the vaccination their older children are supposed to get to protect them against a certain type of meningitis. Well, let me take my best shot at telling you all about what we call the meningococcal vaccine. The meningococcal vaccine is designed to target against a bacterial germ called the meningococcus. It's a pretty serious germ because if it gets into your bloodstream, it can cause a life-threatening condition that we refer to as septic shock. And if it gets into the fluid between your brain and spinal cord, then it can cause meningitis. How could your child get this organism? Well, they would get it by close respiratory contact, by kissing, by coughing on each other, by sharing eating or drinking utensils. It's for that reason that when kids are in close quarters, such as in a dormitory, at a boarding school, or in college, that we see an increased incidence of meningococcal infection. In fact, 1 in 10 people who get this organism are going to experience a serious complication if they haven't been vaccinated, such as brain damage or even death. The good news is we do have a vaccine to protect your child against this organism as a teenager and as an adult. We call it the meningococcal vaccine, and we tend to give it at age 11 to 12, basically before kids go into close quarters, so it has its effect. We'll give a booster during adolescence, but we can give it at any time. The good news is it protects against most strains of this bacteria, so your child has a much lower chance of ever getting this particular type of infection. Are there side effects? Well, we're not giving the whole germ to your child. We're giving parts and pieces so your child can mount an immune response. That means they're protected in case the actual germ gets into their body. So what are the side effects? A little soreness at the site of the injection, a low-grade fever for a day, and in rare circumstances, an allergic reaction that is certainly treatable. So that hopefully tips like this, not just sharp tips, will stick with you and with your teenager when it comes to encouraging them to make sure they get the meningococcal vaccine. This is pediatrician Dr. Lewis First, reminding you to always be first with your kids.